Hi, I'm Liliana Partida, the nutritionist at the Center for New Medicine. Today, I'd like to talk about the pros and cons of a ketogenic diet. So, all of you know that ketogenic is a buzzword out there, but for those of you who don't know, let me share with you what that actually means. Now, a ketogenic diet is a way of calorically restricting. Now, either it's with calories or with glucose, in creating what we would consider a deficit in terms of caloric need for your energy. So what does it do is in the lack of calories and or glucose, it looks for a secondary source of fuel. The body, the liver in and of itself, breaks down fatty acids and turns them into ketone proteins that can facilitate an energy for the brain and for the metabolism. Now, why would we do that and what it would be the benefit of it? Well, as far as our primal blueprint, when we were cave people, we didn't have the source of food that we have available 24/7 today. We didn't have any refrigeration, any homogenation, and the agricultural age wasn't even there to store food. So what we had to do is we had to rely on our primal instincts of hunting and gorging and storing, so that when we were in absence of food, that we had calories to live off of, namely our fats. Now, our body will go to using the quickest source of energy, which is usually our muscles. So it's over a long period of time, we have the negative aspect of muscle wasting. And so originally the ketogenic diet was studied and utilized for seizures, because the calorie restriction allowed for these ketones to fuel the brain and to cease seizures. And then it started being utilized in areas of reducing body fat, and also for supplying an energy to cancer patients that didn't use a glucose pathway. And so many people are on a ketogenic diet, but let's talk a little bit about the pros and cons of long-term use, and also of even doing it in what we would consider a clean keto style way. Now, for many of you, the internet has great accessibility into getting to have information about this, but it's not necessarily showing you the cleanest and the least inflammatory way of going about it. So if you've done any research, you know that a ketogenic diet is approximately about 15 to 20% of your total calories in protein, about anywhere between 5 to 8% of your total calories in carbohydrates, and the rest in good, healthy fats. Okay. Now, some people take it a little too far, meaning that they can have all the fats that they want, and they end up using a lot of what we call inflammatory fats, like cheese or unhealthy oils, because they're frying foods, and even though they're not frying French fries, they might be having, let's just say, fried chicken, all right? And even if they're doing it keto style, those are oils that are going to create an inflammatory response. So it's not all the oils that we could consume and it to be okay. We want to be very mindful of the fats that we use, that we can use them to rebuild, especially with our hormones, and utilize them for our immune system. And so when we do clean keto, we're very respectful of fats. I tell patients to not adulterate them by heating them and frying foods, but to use them more in a way of, after the food is cooked, to just drizzle olive oil on your vegetables, which is very easily digestible oil, especially the olive oil for its omega-6 and 9 components of supporting, that cascade of inflammation. So it is higher in fats, but that doesn't give us the liberty to put half a cube of butter on our vegetables, or all the cream we want to have, or all the oils we want to take in, because that will cause oxidative stress. Now, the other thing is that we have a healing center that we're treating a lot of immune compromised patients here, namely with cancer. And so there are some foods on the ketogenic diet, like cheese, that's very acceptable and utilized in a lot of the recipes, which for us is considered something that could raise insulin growth factor, which could make tumors grow. And so we don't have cheese as part of a healing treatment plan. But if you were a person that just wanted to lose weight and you did not have an allergy towards dairy, then you would be allowed to consume that. Goat and sheep better than cow, it being a better source for the body to utilize, more like mother's milk. So it just depends on the patient that we're treating or the goals that you want to achieve. Now, the other thing is that people don't realize that if they eat more protein than they need or their body can utilize, that can also convert into sugar as well as a glycogen. And so again, it can be stored in the triglycerides and or our fat cells. So this is why it's moderate protein. When you're young and you're in your reproductive state, we use about 30% protein, or if you're pregnant. The needs are far different than if you're already at a state of maturity. We don't need any excess for anything to grow or insulin growth factor to be elevated. So a lot of times on ketogenic diets, they eat too much protein, and then they wonder why that after a couple of weeks they're really not losing weight anymore, and it's because their body is converting that into the glycogen, which is adding to their sugar load and taking them out of a ketosis state. Now, a ketosis state isn't necessarily something that we want our patients to be in 24/7. It's very hard on the kidneys and very hard on a psychological level of not getting to eat those foods that the rest of your family are consuming. And so again, my whole goal is to have swap outs, because the body's looking for all aspects of sensation, whether it's a crunch like a toast or a cracker or chips, or the salty or the sour or the sweet. So we really want to build that in, but with foods that are very, very low sugar and ones that the body can actually use to support the immune system. So a healthy way to go about a ketogenic diet is, say 20% of what I'm going to consume in calories is going to be protein, approximately about 3/4 of the palm and the thickness of your hand. Then the carbohydrates that I'm going to consume, to kind of keep to women somewhere around anywhere between 12 and 14. We don't really take people into severe ketosis unless several things. One, that it is glioblastoma, or it can be a pancreatic cancer mostly. Do we need to go that severe? But for most of my patients, I have them more in a keto adaptive mindset. We move them in and out of ketosis to have less stress on the body. And so a lot of patients that have already lost a lot of weight, I really can't put them on a severe ketogenic diet because they'll eat up all their muscles, and we need to have their strength. So really it depends on individually and how you're going about it. For weight loss, we've got plenty of fat to utilize for fuel. So we're always in a pretty free zone with that. We can be more strict with that. And so everything is very patient specific. So in our mindset, if we say to ourselves, okay, we eat a moderate amount of protein, we fill our plate with 3/4 of what we call non-starchy carbohydrates, things that are watery in nature, things that are not sweet to the palate. And then if we choose to have something that's a little higher in carbohydrates, it's going to have one of these 3 characteristics. It's going to be sweet to the palate, like a carrot or a beet or corn or peas or butternut squash or yam or fruit. And it's also not going to have any water in it after I have cooked it, like a potato or a carrot or pasta or rice. And so on a ketogenic diet, we don't have any grains, and we don't have any what we call tropical fruits. We may have berries for antioxidants because we want to keep quenching the free radicals as best as we can, whether it's through aging or through its disease. So the ketogenic diet is very, very effective to giving you energy that the body can break its own stores of fuel, which is fat, and not have cancer fuel off of the whole pathway of glucose. And so the patients who have lost too much weight, I put them on endogenous ketones. That means in between their meals, they might take some MCT oil, which is coconut oil, or an endogenous ketone powder, so that they don't have to use their fat. And then they can use this so that we don't lose weight. So again, it's very specific. But the negative aspect on a ketogenic diet for too long of a period of time, especially for women, it can down-regulate your endocrine organs like your thyroid and your adrenal glands. And of course, that's an energy aspect, so we want to be careful. If you're a diabetic and you're on insulin, that would also be concerned that we would have to start lowering your medications down. If you were lactating and you were breastfeeding, we don't want you to be on a caloric restriction diet as well. And so people say, well, how about if I have kidney disease and things of that nature? We have not found any problems with any of those issues, not cholesterol issues, kidney disease, because we really kind of, with the lab work in regards to how we put their foods together, make it so that it's very effective with the least amount of complications to any other organ systems. So the thing I love about a ketogenic diet is you get to use your fat for fuel. You have great mental clarity. Your cravings will be diminished as far as wanting to have treats that really are not healthy for you. The likelihood of longevity because of the caloric restriction is 100%. And who wouldn't want that? Who doesn't want to stay younger longer? Who doesn't want to think better? And who doesn't want to live longer? So I am very much a proponent of a low carbohydrate diet, whether you move in and out of cycling of ketosis or just a very low carbohydrate diet. So I hope we gave you some information that will be useful for you today, and you can just be experimental with yourself and just try to lower those sugars. And that's all things that don't have any water in them or expand or are sweet. You have a great day.